Why is brain balance do we focus on the visual motor system? Because the visual motor system is critical for us to pay attention and for us to be able to lock in on a specific point of interest. If a child is in the classroom, they want to focus on the teacher and they don't want to get distracted. So the fixation system is the ability of that child to keep focused on the teacher, so that if a child is moving to their right, they don't turn their head to the right and be distracted. If they see some type of movement in their visual field, they don't get distracted and look in their visual field. So it's a very critical part of the brain. Now the fixation system is very similar to the quick eye movement system, or what we call the saccadic system. The difference is that we're not moving the eyes to a point of interest, we're locking the eyes in place. So the fixation system starts in the parietal area of the brain that tells the brain, this is very important for you to look at, and this is very important for you to stay focused on. Then the parietal system sends a signal to the prefrontal cortex and the frontal eye field, which then sends a signal to a part of the brain called the basal ganglia, which inhibits the eyes from moving and allows the eyes to fixate and lock in on a specific target. And that occurs in a part of the brain we call the superior colliculus. Superior colliculus sends a signal down to the cerebellum and to the vestibular system, which then sends a signal to the eye movement system. But this time, the eyes are not moving and the eyes are fixated. If there are gaps in any of these areas, in the parietal area of the brain, in the frontal part of the brain, in the basal ganglia area of the brain, in the cerebellum, which is the master planner, or the area of the brain that really fine-tunes cognitive ability and movement, we are going to have an inability to fixate. And this could cause severe distractibility in a child, focus issues, attention issues, visual processing issues. It could affect sports. It could affect the coordination. With brain balance, we use this fixation system to be able to stimulate all these different other parts of the brain as part of our multimodal approach to improve whole brain connectivity. And we do have a very, very exciting, scientifically validated device called RightEye. The RightEye system tracks a child's eyes as they're doing various visual motor movements and also as they're reading. So in this system, there are infrared sensors that are coming up from the bottom of the screen while the child is doing very specific eye movements, like smooth pursuit movements, following and locking in on a circle they have to track, tracking an object from left to right, up and down. That's called smooth pursuit. RightEye also tracks what we call saccades, or quick eye movements, which are critical for paying attention, for reading, for sports. A saccade is a quick eye movement. So if I put my two fingers up like this, and I look back and forth between my fingers, each one of those jumps is called a saccade. In addition to saccades and pursuits, the RightEye system could also assess the child's ability to fixate. So the child is asked to stare at a dot on the screen. Now this dot is not moving, but the child has to focus and keep their eyes fixated on this dot for about 10 seconds. Now, when the eyes are fixating, there are also little micro movements of the eyes, so the image doesn't fade from the retina. But those movements are very small. So if that system is not working, we're going to see on the screen these dots being scattered all over the screen and not focused into the area of fixation, which is like a bullseye. We want to see all the dots be in the bullseye, but many times when children have gaps in attention or gaps in fixation, we see those dots scattered all over the screen. And the beauty about the Brain Balance program is, by working on all the different systems that require visual motor function, going back as far as improving and integrating primitive reflexes, core systems, body awareness systems, visual motor systems, visual processing, auditory processing, synchronization in the brain, having all these systems fire and wire at the right time and talk to each other, and then stimulating cognitive systems, we see significant improvement in fixation ability, in smooth tracking ability, and in quick eye movement ability.